perhaps what I could do is maybe go first to Dr. Alexandra Greenhill, who could speak first about the impact of the program she's been working on and how has it changed lives?
Thank you so much, Brigitte. I still practice as a family physician, and this is one in a lifetime experience. When I first started practicing, we had the SARS crisis hit us, but of course, what we've experienced with COVID is dramatically different. And the most vulnerable amongst us tend to be people who are older and failing health at home. And for any one of us here present who are taking care of somebody like that, you know how isolating it can be. Well, imagine that with COVID, that became even more isolating. And the risk was that people failed at home, ended up in the emergency room, and they were so far along that they couldn't avoid nursing home, which none of us want for our loved ones. And so through the Supercluster, we jumped to the challenge early COVID and took our existing digital healthcare platform with Care Team, which is based on creating connections across the silos of healthcare and creating a system, added the technology of 3 leading healthcare companies in Canada, Alaya Care, CareDove, and Cognizant MD, and created a virtual network around people who are vulnerable at home, helping directly 3,000 seniors in one location, but expanding around the Ottawa region to 19 other sites. So family members who were located far away from Ottawa didn't have to worry about their loved ones and could see what was happening. And also people who were located in the city but had reasons for which they couldn't visit their loved ones could know what was going on, which association, which organization in the community was involved, which people had needs that were not met, and how can we better support them. And that experience was just incredible in terms of the rapidity with which this project came together, but also its impact. And at the end of the day, it also had a great opportunity for us financially as a company, because that led to additional contracts. So we've won 4 opportunities since then to take that initiative, not just to the Ottawa region, but across the country to many more communities where elderly were isolated at home.
Dr. Greenhill, I can see here on the slide, 3,000 high-risk patients supported. That impact is remarkable. Any stories that you can share with us, just, how that maybe has changed one of those individuals' lives?
Well, for every individual that we change their life, there's usually a multiple impact, because this is the 3,000 patients, but there typically is at least one caregiver who was in the process of burning out or losing their mind or not knowing what to do. Their family members across the country who were anxious as well. And they could literally digitally create a network around the person and say, okay, who's dropping off a meal? Are they getting the equipment that they need for their home visits? And so you could real time see, all of us who've experienced Uber and Lyft, you can see the little car coming to your way. We're almost there in terms of enabling that type of experience, so that you know that there's somebody scheduled to go visit your elderly relative or provide the support that you need. And then on the other side, there's also the burnt out caregivers. We've seen the burnout in the profession go up to 75% or more of nurses, doctors, and allied health. And so the stories that touch me the most are perhaps also the ones saying that I enjoy practicing again. I don't have to play phone tag with family members or agencies. I can see the impact of my direct contribution to this person. And I know that this person is not then left on their own, but they are taken over by a hand of other set of helping hands. And so that has really improved the quality of life of the clinical team supporting patients as well.
So important at a time like this, where we're seeing those frontline healthcare workers just so taxed. Thank you. I want to go next to, and I'm not sure what order the slides are in, so I might be messing with the back end of this. I'm happy to go to the next slide. If you want to put it up, I'll call on the panelist there, or I'll just take the lead and jump ahead. So we'll see what happens here in technology. I'd like to next go to Shiraz Kapadia, the CEO of Invixium, to talk about Healthy Access Project. There we go. See, the technology worked. And just maybe walk us through a little bit about what this biometric solution is, and again, around the impact, if you could.
Absolutely. Thank you. And you were bang on right. So you should have paid the lottery today, I guess. We are we are a Toronto-based company, and prior to when the pandemic was announced, we were known for providing security, meaning physical access control with the use of biometrics. So instead of using PIN pads or cards or fobs to gain access to a work site or to gain access to a door to prove that you are who you say you are, we were modernizing that antiquated access control space, with the use of biometrics. Biometrics can be defined as the unique characteristics that we as humans are born with, like fingerprint or the facial features or the vein pattern inside our palm or hand. And scientifically and biologically, it has been proven that biometrics are unique from individual to individual. So all was good. And then I remember I was sitting in a hotel room in the month of March at our office overseas in India. And 11 o'clock, come from the office, turn on the TV, and lo and behold, March 11th, WHO announced COVID-19 as a pandemic, and overnight everything changed in the world. Nobody knew what work from home was. Nobody knew what it meant to be touchless access. These are new words that were immediately they probably went through a century worth of adoption, in a span of weeks. So that was all fine. That pandemic was announced, and nobody wanted to touch anything at entrance points. Everybody viewed entrance points as, oh, it's just for security. Make sure that you use the key, and only the right people come in, and the wrong people don't get in. But nobody knew that you're going to be greeted by a security guard with a thermal gun to check your temperature at the time. And as a company, we actually, candidly speaking, were in significant trouble because in 2019, 90% of our revenues came from fingerprint-based access control, something that you have to touch. And yeah, nobody, government said, well, we are banning the use of anything that people need to touch. And it was a very difficult decision. I had to call a management meeting in the middle of the night, and what are we going to do, because this has a direct negative impact on the business, but also felt a sense of responsibility that yes, we are a business, but the whole world is going to be facing this negative impact. And we very quickly pivoted, and we said, we have facial recognition as a technology. So the product that you see on the right of the slide, that's what gets installed on the side of the door. Any work site, turnstile, doesn't matter. And without touching, it does your facial recognition. And we said, let's also eliminate the need for work sites to employ somebody to take manual temperatures and write it on a piece of paper. The data is going to be lost. So we didn't want to change the employee experience or the visitor experience. So now the same product or the same solution, you stand in front of it, it does your facial recognition, it takes your temperature in a very innovative way. All that data can be logged by the employer to present to the regulatory agencies, because there are mandates now, and the governments were busy locking the world down. But we, I think, all knew quickly that the locking the country down is one thing, but to convince people to come back to work is going to be a challenge and a half. And we rapidly came out with this solution. I got in touch with Digital Supercluster through our investor, Business Development Bank of Canada. We had the discussion and said, I have this idea. We can do this rapidly, but we can't do it alone. We're going to need help of some other companies, and we're going to need quick funding. And it was fascinating how the Supercluster was able to turn things around, and it also proved and many people's notion now that governments are usually slow, but in this case it wasn't the case. So we came out with a solution, and the minute we put it out in the market, more requests started coming in. Well, can you detect? Can your solution detect whether somebody's wearing a mask or not? well, can you do facial recognition when the mask is on, and so on and so forth. And we had the best revenue year in the history of the company in 2020. So going from like massive trouble to actually, the company having a good revenue year, but to actually being able to provide an autonomous productized solution to the market. And it's helping employers, work sites all over the world.
And I can see how important that is going to be even in the coming months as we try to get more people back into the workspace. Shiraz, thank you so much. I'm going to go to Dr. Sheila Wang now, the CEO of Telewound Care Canada, to give a brief overview of your project. Go ahead, please.
Thanks, Bridget. So I'm the Chief Medical Officer of Swift Medical, and Swift Medical is essentially this wound management solution. We combine a Health Canada registered fiducial with machine visioning on a smartphone to accurately measure and track wounds. And this really enables us to do virtual consultations and feedbacks via wound dashboard. Swift Medical, we're currently the #1 digital wound solution globally. And so that's over 3,000 healthcare facilities that's using our technology that do over 300,000 evaluations every month. And we work across the care continuum in Canada, in the US, and Europe. So as many of you know, during COVID, what happened was a lot of patients that were receiving home care, and really 50% of all patients receiving home care in the communities are dealing with a wound. And those patients lost access to this critical wound care. And so what really the Supercluster did was it allowed us to bring together our clinical partners, and we were able to work with them to develop solutions for clinician to clinician and patient to clinician consultations and virtual care. And during this time, we were able to develop new AI, machine learning algorithms, this really state-of-the-art multispectral imaging for allowing us to assess wounds and the patient connect as well. And really in this short amount of time, it's really astounding. But we've seen such positive outcomes. We've already seen a reduction in the number of emergency visits. We have seen a reduction in the number of hospital admissions. Patients that had difficult to treat wounds needed services for less long. And the costs of all of this wound care went down because there was less spending on the products for wound care, like dressings, and there was less money spent on nursing hours. And, really the most important thing is that some of these patients who had really hard to treat wounds actually got better. We had one lady who had breast cancer, and she had breast surgery on both sides to remove the cancer. And for 6 years, her wounds didn't close. So for 6 years, she had gaping wounds on her chest. And these are very difficult to treat and very hard to heal wounds. And she joined this interdisciplinary team that was supported by our Swift technology in January. And now, for the first time, both wounds are completely closed and healed. So, when you're talking about impact, when we're talking about what is the effect that we have on people, this is what we're seeing. And I think what we're doing is we're really setting the new standard of wound care. It had to happen when COVID hit, and it's not going away. And this is going to set the new standard for telemedicine and wound care, I think, during COVID and really beyond.
Life-changing. Thank you for sharing that story. Thank you. I'm going to go to Andrew Redden now, the CEO of NPower, and we've had the advantage of seeing the video, so we know more about his project than perhaps we had with the other three of you until just now. Andrew, so happy to have you offer a few more insights about your program, but I would also like to hear from you just what you see the value in the Supercluster. How did it help the project come to life, and how did it change the impact of what you're doing?
Thank you so much, Bridget. That's an excellent question. And thank you all today for having me. Really pleased to join today's conversation. And certainly the Supercluster has been instrumental to our success. Without the Supercluster playing a really key strategic role in bringing public and private sector partners together, we wouldn't be able to serve the additional 2,500 youth from low-income, diverse backgrounds who were currently upskilling for tech careers through that Canadian Tech Talent Accelerator project. our project really serves to act as the bridge between supply and demand. Working with the government of BC and other public sector and nonprofit partners to identify those young adults in our community who had already faced systemic barriers to labor market participation, hadn't seen themselves represented in IT STEM, and of course, with the impact of COVID, have often been displaced from retail, hospitality, and other types of employment some of our youth were able to secure previously. So those community partners have been pivotal in terms of helping us reach youth in need of an accelerated pathway to sustainable employment, and then working with Microsoft and our other industry partners to really better understand from a demand perspective, what are those critical roles requiring digital skills that employers need to fill, and what are the skills ultimately needed for those roles, so that we could reverse engineer our accelerated no-cost training program with that feedback. And so ultimately, we're then equipping youth from these communities for meaningful careers for both the present and future of work. And the Supercluster's cross-sectoral model is so key to us being supported and championed to serve as that bridge. And so thanks to the Supercluster support, we are certainly able to reach young adults who are in the greatest need of support. So the average young person enrolls in the CTTA program with a household before tax household income of just under 32,000. So this is clearly a very financially challenged group that is really often coming to us having endured multi-generational poverty. Also, 85% of our enrollees come from BIPOC communities, so Black, Indigenous, and other racialized groups. We also really aim to address the underrepresentation of women in IT STEM. So more than 40% of our participants identify as female, transgendered, and or non-binary. And so it really is imperative for us to reach those youth who haven't seen themselves reflected in IT, but have so much talent and passion and motivation to really harness those great skills and attributes to then help our youth emerge from poverty, launch new careers, and in doing so, provide industry with a growing pipeline of diverse talent. We're happy to say that even at this early stage where we have had our first initial cohorts of CTTA graduates, our goal is for 80% of our graduates to secure IT-related employment or enroll in higher education. I think there's a bit of background noise.
Sorry, I think somebody's got their mic on. If they could just turn it off. Thank you. And Andrew, go ahead.
Thank you. Sorry, I would just close by saying that our goal through the CTTA is to ensure that at least 80% of our graduates have secured IT-related employment or enrolled in higher education within 12 months of completing the skills training phase of our program, but happy to share that at only 4 months post-program, more than 75% of our graduates have secured meaningful employment. So we're really excited by the potential of this initiative to really achieve greater impact at scale.